全球新冠肺炎單日感染人數再創新高，唔少國家放寬防疫措施之後，疫情反覆。有專家擔心，民眾鬆懈防疫可能導致新一波嘅疫情爆發。
唉，自從前幾日搬咗入嚟隔離營之後，又冇得出街，連想伸展下嘅機會都冇。雖然話我驗完冇事啫，但係依家喺度坐監，真係好 lonely 啊！從不喜歡孤單一個，可惜偏偏孤獨一個。喂，係你啊 Henry。
喂，係我啊！你喺隔離營嗰邊過成點啊？
唉，呢個地方就係悶死我啦！每日除咗啲輪奸嘅醫護人員之外，鬼影都冇見過一隻啊！到底呢個疫情幾時先可以完結啊？到底仲會唔會有第四波嘅爆發㗎？
你呢個問題問得真係好，我都好樂意解答你呢個問題，但我又真係唔知道答案喎。不如我哋又問下高教授，睇下佢有咩高見啦。
So, we've been talking about comparing SARS with COVID-19 for a while, and now maybe we can compare it with something else, like comparing COVID-19 to the regular seasonal influenza.
Yep.
So that's what a comparison a lot of people made at first and told people not to be afraid of COVID-19. It's not going to be much of a big deal, but turns out it's not. And COVID-19 has been way more serious than your average seasonal flu.
Yep.
So what are their main differences? Yep. And what would be the problems if we treated COVID-19 like we usually did with the seasonal flu?
Yeah, that's a really important question. So firstly, the similarities. So flu is an infection of the respiratory tract, infection of maybe the nose, the sinuses, the throat, and the lungs. And so is COVID-19. Both infect the same parts of our body. They both spread in the same kind of way. So if one of us had flu and we're talking to the other one, maybe coughing or just breathing for a prolonged period of time, maybe 30 minutes, maybe an hour, the other person would have a chance of being infected. That's the same for COVID-19. So the degree of contagiousness is relatively similar. Also, for flu, people are most infectious around the time their symptoms appear, not later on. Remember, for SARS, it's about a week after symptoms appear. For flu, it's at the point when symptoms appear, people are most contagious. And that's true for COVID-19 as well. But then the difference is COVID-19 is much more serious infection than influenza. So whereas for people who get flu, probably you need about 10,000 to 100,000 people to get flu infection before one of them might die. It's less than that in elderly. It's a more serious infection in elderly, but you need a lot of people to get infected with the flu virus before someone dies. With COVID-19, it's about 1 in every 200. So it's a much more serious infection. And we did some calculations in the early days of COVID-19 to imagine what might happen. So with seasonal flu, most years in Hong Kong, the government really doesn't do much about it. It just comes, lots of people get flu, so they're sick for a few days in bed maybe, and then back to normal again. Unfortunately, in Hong Kong, about 1,000 people die from seasonal flu every year, but mostly very vulnerable people, very old people, people who are quite frail already. It's quite unusual for a child to die of flu. You know, if there's one child dies of flu in Hong Kong, it's front page news, and there's a lot of concern. Occasionally, there's a heavier flu season and the government might close schools. We've done that a few times in the last few years. Maybe do some other measures as well, but in general, will not do much to stop the flu. And so in a typical flu epidemic, there'll be about 1 million, 2 million people infected and just maybe 1,000 deaths at most. For COVID-19, we did some number crunching to see what might happen if the government ignored it, which they did not, and they should not. If they had ignored it, what might happen? Because we know the mortality rate is much higher, we thought maybe what if there's 3 million, 4 million, 5 million people infected with COVID-19? How many people might die? The answer is tens of thousands. At the peak, if there were 2 million people infected, how many people would need to go to intensive care? A lot, way more than our capacity for intensive care. How many people would need to go to hospital? A lot, way more than all of our hospital beds in Hong Kong. So we have about 30,000 beds in Hong Kong for people in hospital. Of course, people with all kinds of different diseases need to go to hospital, not just with flu or COVID-19. In the flu season, out of those 30,000, maybe 5 to 10,000 are occupied with flu patients at most. And that's when the hospitals get really, really full. With COVID-19, it'd be way more than that. It'd be 100,000 plus people needing hospitalization at the peak, way more than we could cope with. So the government in Hong Kong and governments elsewhere recognized it's really not a good idea to allow COVID-19 to spread. If you remember, Northern Italy, really the hospitals were overwhelmed. And that was at quite an early point in the epidemic. In London and in New York as well, hospitals got really, really busy to the point of being overwhelmed. And that was not the peak of their epidemic. That was when it was still going up. And if the government hadn't intervened, it would have doubled and doubled again, and maybe even doubled again after that. So really, very, very serious impact. So when we think about the similarities and differences between flu and COVID-19, they do share some similarities in the way they spread, but they're different in their seriousness. And that means we have to treat them very differently. We have to think about them in very differently in terms of what public health measures would be justified. We can't just think it's like the flu. We need to try a lot harder to stop it from spreading, because otherwise the health impact would be devastating.
Professor Carlin, you mentioned something about the demographics of the vulnerable people in flu and also in COVID-19. And we know that, well, old people seem to be quite vulnerable to COVID-19. A question will be, seeing that this is a global pandemic, do we actually see that other factors, for example, socioeconomic status, plays a role in shaping these vulnerable profile in different countries, or are there other factors that really make a difference?
One of the things that's been really interesting to study, as speaking as a scientist, is how the vulnerable groups in many societies are affected, the lower socioeconomic status workers. So if you imagine what happens in a lockdown in London, all of the people that work in the high-paying jobs in the office blocks can work at home. They can use their computer to talk to their colleagues, to do their work. But all the people that do the lower level jobs, so driving the buses, cleaning the streets, working in the shops and so on, all of those people still need to go to work. So unfortunately, what we've seen in many parts of the world is that there's a lot higher risk of infection in those groups of people, the group with a lower socioeconomic status. And in many parts of the world, those are also the minorities. So it's the racial minorities. We know in London, there were really high infection rates among the Black and Asian and Middle Eastern population in London compared to the white population in London. And it's not the race, it's the socioeconomic status that's really a major factor in that. So there's no evidence that those people are more vulnerable to getting a serious infection if they get infected, but they seem to have a much higher risk of infection because they're exposed, because they're driving the buses, because they're working in the shops and so on. And they're not able to stay at home. They're not able to participate in the lockdown that's protecting many of the other people in the community. So it's been a really unfortunate story. I mean, I heard a lot of bus drivers in London got really seriously ill with COVID-19, for example. And in Hong Kong, in our third wave now, we're seeing a lot of impact in the same types of people, the taxi drivers, the people who work in shops and so on, and restaurants, that those are the people that are getting the serious infections, not the people that have high-paying office jobs that work at home and can stay at home and don't need to go to work every day in the same way.
That's really informative. So on a separate topic, we talked briefly about how we can contain the pandemic. And one key crucial thing is actually masks, as we found out. Can you brief us how effective have masks been so far, and how do masks really work to reduce the rate of infection?
Yep. So good question. I'll talk about masks first, and I'll talk about other measures. So imagine I've got COVID-19. every time I cough, every time I talk, every time I breathe, a little bit of virus is coming out. Not a lot, but a little bit. If I wear a mask, it's going to block some of that virus from getting out into the environment. It's going to catch some of the virus in the mask. It wouldn't catch all of it. It will catch some of it. And of course, I'm not going to wear the mask all the time. When I go to a restaurant, maybe sometimes, in other places, I'll take the mask off. So it's not going to work all the time. And even when I'm wearing it, it doesn't stop everything from getting out into the environment. It just stops some of it. Another scenario, let's say I don't have COVID-19, but I'm worried about getting it. When I go out onto the street, when I get in a bus, in the underground train, the MTR, go to my office, if I'm wearing a mask, it's acting as a filter for the air that I breathe in. And if there was a little bit of virus in the air, the mask might be able to stop it. It might not. It's not 100% effective, but it might be able to help. So if there was just a little bit of virus around and I was wearing a mask, I'd probably have a reduced risk of infection. If I was in a place where there was an enormous amount of virus, if I went into the hospital ward where there were COVID patients, I don't think it would be enough. I think the risk would be too high at that point. There'd be too much virus around. And even if the mask filtered out 90% of it, still there'd be enough left to get in. So what we recognize is that masks reduce the risk of transmission or reduce the risk of infection, but they're not perfect. What we've seen in Hong Kong ever since February is almost everybody's wearing masks, almost all the time. So on the street, in public transport, in schools, in workplaces, and so on, everyone's wearing masks, 99% plus. It dipped a little bit in June, but now it's back up to 99%. Even so, even with everybody wearing masks, we've still got spread of COVID-19 in Hong Kong. We're having a third wave now with more than 1,000 cases in the past month. And that's despite everybody wearing masks. So that tells us masks help. We know that masks help, but it's not enough. We need other public health measures as well. So what are the other kind of measures we can think about? So the basic concept of how COVID-19 spreads from one person to another is it spreads when the two people are in proximity to each other for a little bit of time. So the way to stop it from spreading is to stop that from happening. Totally ideal world. Everybody stays in their own room at home for a month. So there's no chance for one person to meet another person and to pass infection to them. In reality, we can't do that. But what we can do is encourage people to spend more time at home. It's called social distancing or physical distancing. And the way to achieve that is to recommend people work at home, recommend some businesses close, maybe close schools, and facilitate people to stay at home more often so they don't have the same chance of exposure in the community. If they do need to go out into the community, we can also reduce the risk by wearing masks, by encouraging people to wash their hands more, to be aware of maybe there might be virus in the environment, on handrails and so on, and do all those kind of individual things, individual behaviors that reduce the chance of transmission. So those are the general measures in the population as a whole. And if everybody follows those, we'll definitely have less transmission. And then we come on to the specific measures. So that's if we can find the people in Hong Kong or somewhere else that have COVID-19, if we can stop them from spreading, it'll be really, really good. And that's a targeted way to do it. So we don't need to disrupt everybody's lives. We just find the people who've unfortunately got the infection and isolate them in hospital. We're really good at doing that in Hong Kong. But unfortunately, what we found is by the time we find COVID-19 cases, whether it's a taxi driver, a person in an elderly home, a person living with their family somewhere in Tin Shui Wai, whatever, wherever we found these cases, often these people have passed on infection to their family members, to their friends and colleagues by the time we've identified them. So we're too late. What we need to do is trace the contacts. So if I've got COVID-19, if I'm diagnosed, find out who I might have already passed infection onto, even though they don't have any symptoms, trace those contacts, my family members, my work colleagues, my social contacts, and put them somewhere where even if they have been infected, they won't pass on infection. That's a way of getting ahead of the virus. So we identify and isolate cases in hospital at the moment, and we do contact tracing and quarantine of contacts to get ahead of the virus and to try and stop it from going further and further and further. And in Hong Kong, that's been really, really helpful. If we had not been doing contact tracing, I think we'd be in more trouble. We'd have more cases and we'd probably be looking at having to use the kind of measures that are used in the UK, other European countries, and the US, like total lockdowns, so stay-at-home orders. We haven't had to do that so far, thankfully, in Hong Kong, and it's because of all of these measures that we've used in combination with each other.
Moving on to another topic. So back to what we're talking about, epidemiology.
Mm-hmm.
Oh, like we study these measures, we study these like infections, how past epidemics spread,
mm-hmm.
and how can we use them like to predict about future pandemics, and can we actually do so? How useful is that?
Yeah, you got so many good questions for me. There was a really interesting project started a few years ago. The concept was to identify all kinds of viruses in the wild, for example, all the coronaviruses in bats, and then try to rank them in terms of how nasty they might be if they got into humans, and how easy might they find it to spread in humans. If we'd found COVID-19 a few years ago, maybe we could have been better prepared. We would have had an earlier warning. On the other hand, though, it's not clear that if we'd have found the COVID-19 virus or viruses like it 3 years ago, we would have known what it meant. I don't know if we'd have been able to say that this is a really, really dangerous virus and we've got to start making a vaccine so that, now, today, July 2020, we got a vaccine already. I mean, that would be the dream. But in reality, it's still not clear how we can distinguish which of the million bat coronaviruses are the threats to humans and which ones don't pose a threat, because we can't make vaccines to all of them. We have to pick and choose which ones to really follow up. But that's one of the things that could be done in the coming years: better surveillance of viruses in wild animals that pose a threat to humans. And there's an enormous field of research on how to identify those viruses, how to rank them in terms of the threat they pose to humans, and then setting up early warning systems in humans like there was in Wuhan to identify as quickly as possible when a new virus emerges. And that's one of the things that China did really well after SARS. It created this early warning system. So if there's a young adult with pneumonia admitted to hospital in a place like Wuhan, they really try hard to figure out what it is because they're worried it could be another SARS. And that system was the system that picked up COVID-19. Another thing that we can do to prepare better is to follow actually the Hong Kong model. Hong Kong's done really well. So strengthen laboratory testing in hospitals, strengthen infection control in hospitals for when there are patients with these new infections, and have the public health system ready to do contact tracing and quarantine, as we've been doing in Hong Kong. We've seen so many countries now trying really hard to establish contact tracing systems, and it's difficult to set up from scratch. It's really difficult. So in Hong Kong, we've got that system in place already, and we're using it.
雖然話人類總係犯同樣嘅錯誤，但希望今次疫情之後，無論香港又好，世界又好，都係吸取教訓，避免下一次全球病毒大流行啦。
係啊，所以我哋要留意流行病學家嘅研究，並且認真聽取佢哋嘅意見，咁樣大家就安全得多啦。
不如我考下你條 IQ 題咧。
好啊。
如果有一日某個人宣布派口罩俾所有冇口罩嘅人，而唔派口罩俾所有已經有口罩嘅人，咁佢又應唔應該派俾自己咧？喂！